Eran, Bendavid, thank you so much for joining me. We've just had this 30-year-old die. Initially, it was said to be COVID-19 related. Now, with post-mortem tests, it seems the man was not. That said, Queensland's Chief Health Officer has said this: any person who dies who is infected with COVID-19, we declare it as a COVID-19 related death, which makes me wonder, how much faith can we have in the figures of people that we're told this number of people died of this virus?
Well, thank you, Andrew. Thanks for having me on. It's a pleasure being on again. My sense is that this is a very challenging and not a clear or not a question for which there's a clear answer. The reason for that is that if you count any person that dies with COVID as a COVID death, you're going to get much higher numbers of deaths than if you just count those that clearly have died from COVID, from the pneumonia or from the severe illness that is caused by the virus. Because those numbers are going to be so discrepant, there's the potential for these numbers to be used for the political, for the public health measures, for ways that are well beyond just the science. In Italy, back in March and in early April, there are some studies that show that 90% of those who died of COVID had other conditions. And so, did they die of COVID? Did they die with COVID? Depending on your perspective, you're going to get different answers. So,
from what we know, like from your testing, that established the virus is more widely spread than people think, because a lot of people don't have any symptoms at all. So it's more widely spread. We also have this ambiguity about whether people die with the virus or from the virus. Given all that, what is your best estimate as to how lethal this virus is? What would be the mortality rate out of every, 100,000 people with the virus? How many die actually from it?
Yeah. So, so one thing I'll note is that there's not a single number. It's going to be higher in places like New York and Bergamo than it is going to be in Santa Clara County here, where I am in California, because of the crowded conditions, because of the age distribution. If you have an older population, you're going to have a worse mortality rate than if you have a younger population. What I can tell you is that the best estimate that the CDC, the U.S. Center for Disease Control and Prevention in the U.S. came up with last week is about 0.4 overall among those who are symptomatic, and then about a third of those who are infected are asymptomatic, and so it comes to about between 2 and 3 per 1,000 people with the infection end up dying from it. Even within that, you can think it's much lower for young people than for old people. And so, for young people, you're talking about somewhere in the range of 1 per 10,000. For old people, it's going to be, substantially higher than that. But one thing that is clear from all of that is that it is much lower than some of the original numbers that were in the original studies and in the WHO and some of the cohort studies that looked at 2, 3, 4, 5% of those who are infected. It's much, much, much lower than that.
So instead of, the World Health Organization was saying like 3.4% mortality rate, you're saying, the latest Center for Diseases Control is
more than 10-fold lower than that. Yeah.
Well, how does that rate compared to the flu?
Well, the reason I'm not a big fan of this comparison is that the flu can actually be a pretty nasty disease and can hit people quite hard, and so I don't want to make that comparison, because that tends to make people take the coronavirus maybe a little bit more lightly than they should. But there are a few things. One is it seems to be a little bit higher fatality rate, not a lot higher, a little bit higher than the flu. But you also keep in mind that there are a lot more people who are susceptible than the flu, because in any particular flu season, you have some people who are immune, you have some people who got it previous years, and so they're partly protected. And so for the coronavirus, you have a lot more people currently that are susceptible. And so even if the fatality rate is in the ballpark, maybe 2 or 3 times higher than the flu, the overall impact of the epidemic can still be quite substantial. One thing that is very different between these two diseases is that flu tends to hit young kids as well, and this disease really tends to spare the young children, pretty much entirely, and that has important implications.
It sure does. Eran Bendavid, thank you so much indeed for your time.